Yes.
The extra credit opportunity where we can use a academic article of our students summarize.
Yeah.
How long does that summarize? 3, 4 pages, or like shorter than that? Or just the
The length is not as nearly as important as the quality of the summary.
So basically, an article about it's about rest intervals for exercises relating to forearm and elbow flexors, and does a maximal workload value, and then they want to they basically do like a meta analysis of it and see which has better both hypertrophic effects, but also sport specific impact and other metabolic functions.
So, what's the pharmacology angle?
Oh, that's the pharmacology. That would make sense. Never mind.
I prefer it has something to do with farm.
That's fair. I don't think it has farm. I'll look into it more.
Okay.
That's fair. That's fair. I forgot.
Yeah.
Thank you.
Good morning, all. So we are missing our softball folk. So they are, if my memory serves me right, going down to Mount Vernon in Ohio. Is Mount Vernon near Columbus? Probably an hour away. So Columbus, you probably heard about the unfortunate and very tragic shooting of that 13-year-old who was wielding a knife. If a cop tells you to drop the knife, drop the bloody knife, for goodness sake. People. Anyway, so there's quite a bit of unrest. My understanding is from colleagues I have on the Ohio State campus. It's apparently rather ugly there right now. So hopefully they're not anywhere near that. And I don't know how far out that would spread from Columbus. The greater Columbus area is pretty big. And if you go around there, they're building like mad out there. The economy out there seems to be booming. So that was an aside. By the way, so let's keep them in mind and hope that they don't get stuck in any sort of protest, traffic-related traffic stops or something like that, and get there and play well and what have you. So also, on another note, I don't know how many of you know nursing student Audrey Morris. Her dad passed away last night due to COVID-19. It was, Allison, it was last night or was this morning? They took him off the ventilator and he okay. They were giving him a trach so he could breathe through the trach. That didn't, okay. Audrey works in admissions, I think, and dear lady. So let's keep her. She has a 4-year-old sister, a 17-year-old sister, and an older brother. So she has family members to lean on, but being the oldest daughter, she gets leaned on a lot. So this can't be easy for her in any stretch of imagination. So let's go to prayer then. Father, thank you for this day, that it's going to be warmer today, not so dastardly cold. We thank you for our softball team. We pray for their strength and for safe travel, and that they wouldn't have any mishaps on the way down or back. Please help them to play to the best of their ability. We also pray for the Morris family. For one of our own, Audrey in particular, Lord, please lift them up. Let them know that Mr. Morris did have a life well lived. He did serve you. He did serve his family. And now, Lord, be their joy, if there is joy to be found in this midst. Help us to be the ones who lift Audrey up in every way possible. In Jesus' name, amen. Okay, I wanted to tell you about something that you may not have heard about, but babies, when they're in the womb, have a connection. Oh, good gosh, that is dreadful. Have a connection between the aorta and the pulmonary artery. Remember, baby's not breathing air. Baby's getting oxygen from the placenta. So the amount of blood, flowing through the lungs, what is it with me in mornings? My voice is this way every frickin' morning. By 10 o'clock, this is done. It's difficult to describe how irritating this is. So there's a connection called the ductus arteriosus. The ductus arteriosus. And that ductus arteriosus, you could see that little connection here, essentially is going to provide a bypass between the lungs and the systemic circulation. So you have an umbilical vein and artery, and as the blood returns from the placenta, it's already oxygenated, because that essentially is the lung during fetal life. Now, when you're born and you take your first breath, that first breath is so crucial. Two things, well, actually about 20 things happen, but two main things happen. Number one, the pressure in the lungs greatly increases the pressure on the right side of the heart. That little trap door you have in your atria between left and right, that increased pressure is going to slam that thing shut, and then your body's going to knit it together. So the hole in your atria shuts. Two, your body produces, or rather stops producing prostaglandins that keep the ductus arteriosus open. Because it's prostaglandins that are going to keep that thing open during fetal life. Now, some babies, when they're born, this doesn't close. That's called patent ductus arteriosus. Patent ductus arteriosus. And you have a leakage, if you will, of blood from the aorta to the pulmonary circulation. And it's in that direction because the pressure in the aorta is higher than the pressure in the pulmonary circulation. So what you do is you give NSAIDs to the baby. The NSAIDs will cause the ductus arteriosus to close. That is one case where you would give NSAIDs to a baby if they have patent ductus arteriosus. And you can tell because the baby has a blue tinge and they can't ever really fully oxygenate their tissues and what have you. Their pulse ox just won't get up into the 90s and what have you. And that's a pretty good sign. And then an ultrasound can tell you if you have patent ductus arteriosus. Now, going back, the FDA has actually updated the recommendations about NSAIDs during pregnancy. So this is from the medical letter, end of last year. Turns out if you take NSAIDs after 20 weeks of pregnancy, you have a higher risk of the baby having low amniotic fluid. This low amniotic fluid is called oligohydramnios. Oligohydramnios. And I don't know if you can read that off the chart there. Let's see if we can. Nope. Oh, there we go. Now can you read it? Okay, so right here, that term right there, oligohydramnios. That means that you have low amniotic fluid levels. You see, during this time, the head and neck are starting to become so developed that the baby can swallow. And the amniotic fluid gets recycled. The baby swallows it, and then the baby's urine actually contributes to the amniotic fluid. If the kidneys aren't functional, the amniotic fluid levels are very low, and NSAIDs in babies will disrupt kidney development. So you get oligohydramnios. That's a potentially very dangerous situation for the baby. It suggests the kidneys are not functioning, and so FDA now says don't use NSAIDs after 20 weeks of pregnancy. But you can use Tylenol, you can use acetaminophen, but not other NSAIDs. So that answers the question about NSAIDs and pregnancy, and also when and only when you would give NSAIDs to a baby. Okay, so we talked about the salicylates. Salicylates. So the old granddaddy is aspirin. Aspirin comes, remember, aspirin is unusual among the NSAIDs because it is a irreversible inhibitor of cyclooxygenase 1 and 2. The other salicylates and, in fact, the other NSAIDs are competitive inhibitors of COX-1 and or COX-2. Now, NSAIDs cross the blood-brain barrier. Because they cross the blood-brain barrier, they can they can quell fever. They're antipyretics. So they can prevent peripheral inflammation, and they can decrease fever, which is a more systemic effect of inflammation. They act in the hypothalamus. In the hypothalamus of the brain, you have a temperature control center. And molecules that mediate inflammation, in particular, the markerless wonder. Okay, no markers. I thought it was only the mathematicians that dealt with all the markers. Your immune cells secrete something called interleukin-1. Interleukin-1 goes to the hypothalamus. And in the hypothalamus is the temperature setting center, or sometimes it's just called the temperature center. And it will essentially tell the center to raise the body temperature. And that produces what we commonly call a fever. Now, when you have a fever, you feel like crud, right? Right? Yes. Yes, but fever actually has lots of benefits for fighting disease. Did you know that? Because it, first of all, your white blood cells, they work much better at higher temperature. Antibody production is increased. Enzyme activity goes up. Also, microorganisms, they don't grow as well at higher temperature. And another bonus, you feel awful, so you rest. That way, your resources are channeled into fighting the infection. So fever is actually good. And you know what studies have shown? If you don't take something to deal with fever, you actually get over the illness faster, consistently. That's been shown consistently for both viral and bacterial infections. But what if fever gets too high? Then you can start to damage organs and tissues. So in that case, you want to bring the fever down. How do you bring the fever down? In the temperature setting center, interleukin-1 induces the synthesis of a prostaglandin. That's essentially the signaler inside this center that causes your body to raise the temperature. And NSAID will stop the production of that prostaglandin and your temperature goes down. So this is what we mean by an antipyretic effect. This is due to the fact that these drugs cross the blood-brain barrier. So the maximum amount of aspirin you can take per day is 4,000 milligrams. That's 4 grams. It will irreversibly inhibit platelet function for 8 to 10 days. And you never give children below the age of 16 aspirin if you suspect they might have a viral infection because of a condition called Reye syndrome or Reye syndrome, depending upon how you pronounce it. So
if fever like has all those positive things, then why is there like such freedom given to like infuse like trial therapy?
cryotherapy is more for damaged tissue because inflammation sometimes, in order to, inflammation is meant to deal with the debris, but the inflammation does more than deals with the debris. It actually further damages the soft tissue, usually the muscle, the tendon, so on and so forth. Therefore, the healing response is delayed because that healing, even though it starts in the midst of inflammation, is very slow at first. If you take the inflammation response and kick it down so that it just deals with the debris, then usually the healing, number one, is faster. Two, the damage to the muscle is limited. That's the other reason you use cryotherapy. Cryotherapy also, if you use it during surgery, you decrease the amount of damage you do to the muscle during surgery, or tendon for that matter as well. So Reye's syndrome is characterized by sudden liver failure. So when the liver fails, lots of things start to go south. So the ability of the blood to clot falls. The ability of the body to handle nitrogenous waste goes down. So levels of ammonia climb inside the blood. Therefore, your pH now of the blood will start to rise. That's going to cause the brain to shut down. The ammonium also causes the kidneys to shut down. And then because of bilirubin metabolism, the liver can't handle bilirubin properly. You start to get jaundice. And what have you. It's in children, this can happen very quickly, and it's very sad. So if there is a viral infection, the classic Reye syndrome is influenza and aspirin, but other viruses can cause Reye syndrome if you give them aspirin with the viral infection. For example, chickenpox. Chickenpox and aspirin can lead to Reye syndrome. So can other types of viruses as well. Viral infections, excuse me. So if you have a child, don't ever give the child aspirin if the fever is due to a suspected viral infection. Reye syndrome, very important cause of death. Oh boy, there was that movie. Johnny Depp was in that movie where he played a gangster. What was it called? Black Sunday, I think was the name of it. His child dies of Reye syndrome in that movie. It's actually a pretty good movie. It's violent, but it's a very dark chapter in the history of the FBI. Would you recommend it, JP? Yeah, no, it's not a happy movie, but it's well done, I thought. This other drug, salsalate, is a salicylate. It is a competitive inhibitor of COX-1, COX-2, just like all the other NSAIDs. And then diflucinol. Diflucinol does not cross the blood-brain barrier. So it has no antipyretic effect, none. Diflucinol is not associated with longer bleeding times either. It has a slower onset, but a longer duration than aspirin. That's essentially what it's used for. It's for peripheral pain and inflammation. Then we get to the more so-called classic NSAIDs. Classic NSAIDs. Now, there are some drugs that just inhibit cyclooxygenase 2. Cyclooxygenase 2. And the one drug now still on the market is celecoxib. Celecoxib. It goes by the trade name Celebrex. That is used for arthritis pain. That's about all it's used for. The rest of them will inhibit COX-1 and COX-2. But some will have a greater affinity for COX-2 over COX-1 and vice versa. All right, so this shows you the three areas where cyclooxygenase will make its presence known. And so inhibition of these enzymes will cause either gastric issues, septic ulcers, GI bleeding, kidney issues, sodium, water retention, hypertension, and then hemodynamic acute kidney injury, and then cardiovascular disease, stroke, increased risk of stroke, increased risk of myocardial infarction, and what have you. Whereas your low dose aspirin is usually okay for the GI tract, okay for the kidney, and usually beneficial for the cardiovascular system, whereas high dose aspirin would really do just the opposite. Okay, so these are used for pain, musculoskeletal pain, pain due to injury, pain due to whatever. That's what they're for, is musculoskeletal pain. They do not work for neurogenic pain. Do you guys know the difference between musculoskeletal pain, neurogenic pain? No? Musculoskeletal pain is due to tendon, joint, or muscle damage. Tendon, joint, or muscle damage. Neurogenic pain is due to either a nerve being impinged upon, or a nerve being entrapped in a scar or some other injury. So you don't have any obvious injury to joints, muscles, things like that, but the nerve itself is damaged. And you get a different type of shooting pain. So for example, sciatica. Sciatica, if you have some sort of either musculoskeletal or some other type of thing, that sciatic nerve, that goes all the way down. It's a big nerve. It's as thick as this pinky, your pinky. And if you have either a knot in your back from overdoing it or whatever, or if you have a disc that's bulging, you'll get pain that shoots usually down the outside of the leg and go all the way down to the foot sometimes, and what have you. We have a former professor of New Testament, Chuck. He goes to church over here, and Chuck has sciatica. He has bulging discs in his back, and he can't sleep. The pain is so bad. The pain just kind of throbs down his leg constantly. That's neurogenic pain. NSAIDs usually don't affect neurogenic pain. If they do help, they only help a little bit. Yes.
Would they help by decreasing swelling of that area?
Yes, they would if it's due to swelling. Because with inflammation, of course, you get swelling. That's one of the signs of inflammation. Signs of inflammation are pain, redness, heat, and swelling, which if you remember it in Latin is easier to remember because it rhymes. Rubor, calor, tumor, dolor. Pain, heat, swelling, pain, heat, swelling, and redness. Those are 4 signs of inflammation. If you decrease inflammation, you decrease swelling. If something is uricosuric, so uric acid is a breakdown product of purines, which are used to make DNA, RNA, stuff like that. Some people have too much uric acid in their system, and uric acid, when it precipitates at surfaces, forms these crystals that look like little sewing needles. And they do tremendous damage to joints. That's called gout. Gout. NSAIDs can be used for gout. That's why they're uricosuric. Uricosuric. And they can, to some extent, even decrease the amount of uric acid that's kept in your bloodstream. That's called the uricosuric activity. Now, there's a list on page 83 of some of the different NSAIDs. So, of course, these two are available over the counter. Those two NSAIDs are over the counter because research has shown that they're very safe. They're safe on the stomach. They're safe on the heart. In fact, of these two, naproxen sodium is the safest, definitely. Naproxen also has a very long half-life. So naproxen, in terms of cardiovascular safety, is definitely the safest of the NSAIDs. Once you get into your more powerful NSAIDs, the risk is not listening. Oh, there it goes. The risk of GI tract irritation, something like that, goes up. But your pain relief gets better. So it's a trade-off. So typically, NSAIDs are not meant to be used long-term. They're not meant to be used long-term because of their effects on the GI tract, on the kidney, on the cardiovascular system. Having said that, some people still use them long-term. Okay. Indomethacin. Indomethacin is a drug of choice for patent ductus arteriosus. So that's the one you give to babies. Indomethacin. Indomethacin. That's a very powerful NSAID. Ketorolac. Those of you who are athletes who've had injuries may have been given this drug. The trade name is Toradol. This drug is not only an NSAID, it also has opiate properties. So it's an extremely good pain reliever. But it's addictive. In fact, some athletes have gotten hooked on it. And in fact, there was a bust, DEAE bust 4 years ago. There were athletic trainers who were giving it out to people, and they were getting it illegally, and they were making money giving it to athletes and getting money for it, and the athletes were getting hooked and getting ulcers and, you know, what have you. So this stuff is a highly controlled substance now, but it's extremely good for athletic injuries. And those of you who've had athletic injuries may have heard of that drug. That's Ketorolac, goes by the trade name Toradol, Torodol. In fact, athletic trainers, I think, I don't know if the FDA pulled back on this, they used to be able to be licensed to give shots of Toradol for injured athletes to take away the pain. So a football player, for example, running back comes in, you know, somebody crunched their knee and they're in terrible, horrible pain. You used to be able to give them a shot of Toradol just so they could be able to limp to the ambulance to go to the hospital and see the ortho and what have you. Diclofenac is used as a gel for injuries. Because of that, it's rather safe. If you take the pill form of diclofenac, it tends to cause ulcers pretty effectively, but it is a very good pain reliever. If you take it orally, you can see on page 83, it comes in combination with misoprostol. Misoprostol induces gastric mucus production in the GI tract. Now, here's the thing about misoprostol. Misoprostol is an abortifacient. You don't give it to women of reproductive age unless you first give them a pregnancy test. Good night, this is annoying. Disco lights in this room, criminy. So let's say Miss Emily comes in, she did too many weights and she did her back and it's just killing her. She can't stand up. She's walking like she's 80 years old. You want to give her a cane and you have this stuff to give her, but Emily, of course, is at that age where she might could potentially have a baby if she wanted to. What are you going to give her first? A pregnancy test. A pregnancy test. Then you can give her the diclofenac with the misoprostol. That is called Arthrotec. Arthrotec. That's the name of that product. Arthrotec. Maybe if I keep moving, it just won't. There. Meloxicam is available as a generic. It's very inexpensive, used mainly for osteoarthritis. For osteoarthritis, has a tendency to inhibit COX-2 more than COX-1. Very effective pain reliever. These here are the most commonly used NSAIDs. The rest are available. They're just not used as much as these. These are the ones you'll see the most. And Allison, since you want to be chiropractor, you'll see a lot of musculoskeletal injuries. These are the drugs you'll probably see most often in your practice. If you take these orally, your doctor will probably tell you no more than 5 days. 5 days, then get off them for maybe 5 days, then do another 5 days or something like that. So ketorolac, because it is also an opiate, that one will also heal or rather treat neurogenic pain, because opioids will also treat neurogenic pain. And then you have some kind of others. There's this one here, etodolac. Etodolac is a form of ketorolac that you give in the emergency room. It's very fast releasing. And then ibuprofen, that's another one. So these are kind of honorable mention drugs. These here come in a form that the pill contains nanoparticles. And the nanoparticles, when you take them in your orally, they release the drug slowly, very, very slowly. Because they release the drug slowly, it lasts a long time, and the concentration in your blood never gets very high. Just high enough to treat the pain, not high enough to give you a lot of side effects. These are kind of new. And the research is still being done on these, but these might prove to be much more tolerable than the more immediate release forms. And you'll notice they all end in O-dex or Orbex, or if they end in X, that just means extended release because of the nanoparticle release forms. So celecoxib is used for osteoarthritis, rheumatoid arthritis. It's also used for pain associated with cancer. And since COX-2 is associated with an inducible result of inflammation, this will quell mainly inflammation. It does not cause GI issues. It does cause kidney issues if you take it for an extended period of time. And its effect on the cardiovascular system it seems to increase the risk of heart attacks, but only mildly. Whereas the others in this group, like Vioxx, rofecoxib, or Bextra, which is valdecoxib, they definitely increase rates of heart attacks. All right, so their usage is for pain. For pain, fever, temperature, for aspirin to reduce platelet aggregation, and what have you. So they're used for chronic pain. They're used for stroke or heart attack prophylaxis in the case of low-dose aspirin. They're used for fever and what have you. And for the COX-2 specific inhibitors, they're used for long-term treatment of arthritis. Let's talk about the side effects. And please turn to page 88 in your notes for me, please. Now, aspirin and the other salicylates at high doses cause something called salicylism. Salicylism. Salicylism has an early and a late set of symptoms. So take a look at the top, page 88 with me. So nausea and vomiting, abdominal pain, lethargy, tinnitus. What's tinnitus? Ringing in the ears. Seinfeld, somebody answer the phone. You guys haven't watched Seinfeld. I haven't either, actually, but that's a joke everyone tells. And Seinfeld, Jerry Seinfeld's dad keeps yelling in the apartment, would somebody please get the phone? Because he has this ringing in his ears. He's losing his hearing. He's getting older. And it's kind of a running joke. Somebody get the phone. And that's essentially tinnitus. This tinnitus, it's, you ever heard a really loud noise? Then you get this ringing in your ear. That's a form of high intensity sound induced tinnitus. The toxicity to the ear usually causes tinnitus. That's a sign that something might be wrong. Some people just get it and it's nothing to do with their hearing and it's very irritating. Vertigo, what does that mean? Room is spinning. The room is spinning. You're dizzy, loss of balance. Okay, that's the early effects. Then the late effects, you get severe acidosis because the aspirin is an acid. So you get acidosis, hyperventilation, metabolic acidosis, respiratory alkalosis, hypoglycemia, altered mental status, tremor, seizure, cerebral edema, coma, culminating, of course, in death. Now, the salicylates act as metabolic uncouplers in mitochondria. So they deprive the ability of your body to make ATP at high doses. Then the acidification of the blood will promote the transport of salicylates into the central nervous system and death by acidosis. So in cases like this, you're going to increase the urinary pH to enhance salicylate excretion. So you usually give something like ammonium chloride. And then you'll do a so-called gastric lavage, a gastric lavage. Those of you French speakers, lavage means to wash out. So gastric lavage will be with things like activated charcoal, things like that. In the early 2000s, they used to use a drug called Epicac to induce vomiting. Epicac's not used anymore. Fire activated charcoal is usually what's used. So the long-term effects usually are bleeding, ulcers. If you have tinnitus, that's usually the first sign of toxicity. Children still die from salicylate poisoning because people take their expired aspirin and they throw it in the trash, and kids put things in their mouth. So, you know, when kids start walking, they walk all over the house and they find things. Gee, where'd that go? How'd you find that? Because they will look places you never thought to look, because they can fit in places you can't fit. And something they will do is they will reach in the trash can. What's this? Oh, that's kind of cool. Oh, there's more there. Yeah. And so what do you do with expired meds? You flush them down the toilet. You don't throw them in the trash. You flush them down the toilet always. Always, always, always. All right. Don't give aspirin with gout. Aspirin increases uric acid retention by the kidney, so it causes uric acid levels to increase. These, by the way, do not apply to low dose aspirin. These apply to abuse of your higher dose aspirin. All right, let's move on now to the others. Ibuprofen is equipotent with aspirin, but is better tolerated. Has a longer half-life, and it is, on the average, usually better tolerated. Naproxen, 20 times more potent than aspirin and is definitely safer. Indomethacin, up to 40 times more potent than aspirin. Yeah, no, that's not safer. Okay, look now on page 89, please. So these are some of the side effects of your traditional NSAIDs. And they're really in order of how often they occur. First and foremost is GI disturbance and peptic ulcer disease. Again, as we said before, if someone upchucks and there's coffee grounds in their vomitus, that's called coffee ground emesis. That's sign of gastric bleeding. Also, if there's just blood when they upchuck that's red, that tells you also you've got a bleeding ulcer, so on and so forth, what have you. Are any of you Downton Abbey fans? No? Okay, never mind. There's a scene in Downton Abbey where Hugh Bonneville's character, the Lord of Downton Abbey, he drinks too much alcohol when he has an ulcer, and one night he's really having a great time, and then he just all of a sudden starts losing it. And it's clear it's his ulcer because there's blood coming up. And that's an example of something you should not do with a peptic ulcer is drink a lot. Renal damage. Now the renal damage can take the form of acute interstitial nephritis or chronic interstitial nephritis. And in both cases, you get inflammation of the kidney. So you might get blood in the urine. That's called hematuria. You might start to see decreased urine output, or you'll see protein in the urine or something like that. They may have pain, flank pain usually, And those are all signs usually of kidney damage. You'll have a great increase in blood pressure and also increase in lipid metabolism as well. Their blood lipids and cholesterol and what have you will also soar. Cardiovascular, I don't think I need to say more about that. Liver, what do you use to assay liver function? There are certain enzymes damaged liver cells release, and the big ones are there's alanine transaminase, ALA, alanine transaminase, and then aspartate transaminase. Those are the two enzymes you're going to assay for. Then you're going to assay also for bilirubin, because if the liver is processing bilirubin, the amount of bilirubin in the blood should be within a certain level. If it's above that, says your liver is not properly functioning. And then albumin, which is made by the liver and released into the blood. So this will be too low. If the liver is damaged, this is too high. These will be too high. These will be too high. Normally, these in the blood is low. When the liver gets damaged, starts releasing them into the blood. These are your sentinel markers, essentially, for liver function. Well, the other one is alkaline phosphatase. Alkaline phosphatase. That's another one. That'll also be increased if you have liver damage. And when you have a physical and the doctor ticks that box that says liver panel, that's what's being tested. Is that's those right there. At your age, unless there's reason, the doctor wouldn't order that. At my age, the doctor will probably just order that because as you get older, your liver function decreases. Now, with renal failure, your blood pressure will go up. Septic ulcers, also a possibility. Stomach ulcers, are they relieved or made worse by eating? Made worse. Made worse. Duodenal ulcers are made better by eating. Stomach ulcers are made worse by eating. So the symptoms are very similar, but that's why you distinguish between a duodenal ulcer and a peptic ulcer, a stomach ulcer. So contraindications for NSAIDs. We just saw pregnancy after 20 weeks. That would be one. Lactating mothers, NSAIDs are released into breast milk. History of GI ulcers. You can use celecoxib in that case, not the others. Bleeding disorders are on anticoagulant therapy. You can use celecoxib, don't use the others unless directed to by your physician. Salicylates and aspirin, contraindicated in gout because they will increase the amount of uric acid in the bloodstream. Renal disorders, no NSAIDs, except maybe low-dose aspirin. That's going to be up to the discretion of your doctor. Patients at increased risk for cardiovascular disease, with the exception of low-dose aspirin. Patients, of course, with hypersensitivity to aspirin. Those people exist too. Then, of course, those who are pregnant. And then, of course, elderly patients, because elderly patients tend to have reduced renal function. COX-2 inhibitors increase the risk of stroke and heart attack, and this has to do with this balance. Remember the teeter-totter between prostacyclin synthesis and thromboxane A2? So COX-2 is inhibited in the endothelial cells, but the platelets actually express COX-1. And that's what they use to make thromboxane A2. So thromboxane A2 goes up, prostacyclin goes down. Now the teeter-totter gets tipped towards clots when you take a COX-2 inhibitor. That's why COX-2 inhibitors are linked to increased risk of heart stroke and heart attack. Now, acetaminophen is different because here's how acetaminophen works. So there's COX-1, COX-2. Turns out there's also a COX-3. But COX-3 is only expressed in the brain. Only expressed in the brain. Acetaminophen inhibits COX-3 in the brain. So acetaminophen does not quell peripheral inflammation. Instead, it affects your perception of pain. It affects your perception of pain because it works in the brain. Acetaminophen is found in lots of products. It's found in Percocet, it's found in Norco, it's found in Excedrin Extra Strength, it's found in lots of different products. So your mission, should you choose to accept it, which I hope you will, and for this class, you better bloody well accept it, is when you buy a pain reliever, check the label. Read the label. In fact, just make a note of this to yourself. Read all labels of all medicines that you get. Know what you're putting into your body. These two products here, Feverol, Ofirmev, those are prescription. Those are prescription. So Ofirmev is IV. Acetaminophen, there's no evidence that IV acetaminophen is better than oral acetaminophen. But some hospitals prefer it because some people are unconscious. You can't give them tablets. Feverol is a suppository, which is very convenient under certain circumstances. So this is an analgesic and an antipyretic. It's not antiplatelet and it's not an anti-inflammatory. It's used for fever. It's very good for children with viral infections and for mild pain. Now, as it turns out, this medication is going to, oh, for goodness sakes, where is that? Oh, no, well, no. I didn't include that. That's a bummer. Okay. So the GI disturbances of acetaminophen are very rare. The big thing with acetaminophen is liver damage. And that's due to the fact that people take too much of it. So your daily dose should not exceed 4 grams per day. Your usual acetaminophen tablet is half a gram. So if you take 2 of those, you should take no more than 8 of those tablets a day. Take more than those a day, you're going to have liver damage. Now, if you tend to take too much acetaminophen. There is a drug you can take that will detoxify the acetaminophen, and it's called N-acetylcysteine, otherwise known as NAC. In fact, you can buy this over the counter at health food stores, or heck, I saw it on the shelf at Meijer the other day. So this is a detoxifier for acetaminophen. Now, acetaminophen is metabolized into a metabolite, and that metabolite is it's called NAPQ, and this NAPQ will cause liver damage. It will cause liver damage. Before it causes liver damage, it is conjugated to something called glutathione. And that's what N-acetylcysteine does. N-acetylcysteine will detoxify the NAPQ. When you run out of glutathione, which is what happens when you take 4 grams of this stuff a day, you get liver damage. Okay, and that's essentially, yeah, that's essentially the whole thing. So don't forget, Monday we have an exam. Sunday, I will be in the library at 7 o'clock. That a good time for everybody? 7 o'clock. I'll be upstairs, either this side or that side of the library, 7 o'clock. If you want to come and chat, ask questions, please come, and I will see some of you then. Please be ready for the test on Monday and make me proud, okay?